I'm Joe. I'm a physical therapist and strength coach who specializes in working with golfers, and I am the owner and founder of Pure Drive Physio and Performance. Today I want to talk about how to improve hip internal rotation mobility by giving you 3 easy areas to target to hopefully improve your hip internal rotation. Why is hip internal rotation so important for the golf swing? Well, when we go into our backswing, we end up going into hip internal rotation on that trail side, and then we do the opposite when we're following through and posting on our lead leg. We are going to be going into hip internal rotation. Now again, why is this important? Unfortunately, one of the biggest issues that plagues most golfers is low back pain. And usually, a lot of times, the main limiter or main cause of that is because you have limited hip internal rotation mobility. Now, why would that be? It's because when we're trying to rotate either into our backswing or our downswing, if we're lacking hip internal rotation mobility, our body will still make up for that mobility somewhere. And unfortunately, more often than not, it occurs in the low back. And the low back wasn't really designed to rotate too well. You're meant to rotate kind of through your mid back and your hips. And again, if you're limited in either of those areas, you can make up for that in your low back, which repeatedly over time, especially with a forceful and powerful swing, that can result in some pain and possibly some injury. So today I wanted to go over 3 simple areas to help improve your hip internal rotation mobility so you can hopefully relieve some low back pain if you're experiencing any, or just experience a better backswing and posting on your lead leg to have just a better overall golf swing. Okay, so we're going to target 3 areas. We're going to go for some deep rotators in the hip. We're going to go for the Gluteus, Medius, and Minimus, and we're also going to go for the Tensor Fasciae or the TFL, which sits on the front side of the hip. So we're going to start with the deep rotators. I recommend that you either use like a softball or a fancy self massage ball, something like this, or you can use a tennis ball. That works just as well. So what you can do is basically we're going to go right into the back pocket if you're wearing pants or shorts, and you're going to go right into that area. You're going to kind of lean towards the side this way here. I would recommend, if you're able to, is to get your ankle of that side up on your knee. That will really help open up the hip a little bit more and allow you to get some of those tissues a little bit better. And once you find a sore spot, that's okay. You want to sit there a little bit and just hold on to that. And the other thing you can do, if you can't get your ankle up onto your knee, is just leave it here. You can lift up a little bit. And then one thing you can do is really try to work on, you can bring it down, you can bring it up, move your knee around, roll around a little bit. I would say spend anywhere between 15 seconds to 60 seconds on a spot or an area and see how that goes. If the tennis ball or softball is just too painful or too sore, I recommend using a foam roller. That will be a little bit more helpful because it's a little bit more broad, so it'll spread that pressure out a little bit more and it won't be as uncomfortable. Okay. So that's the deep rotators of your hip. You can try to get those. That may help with some low back pain. It can definitely help improving your hip internal rotation. Okay, so after that, I would either recommend using a tennis ball or a softball again. We're going to go for the glute, medius, and minimus. So those are going to sit right on the inside or the outside of your hip here. And so you'll see that I'm pretty much really going to be on my side here. And again, you can find a really sore spot and just hang out there. And again, I would recommend hanging out onto it for about 15 to 60 seconds. If you start to feel it kind of twitch a little bit, you might actually be on a trigger point. And that's okay, just kind of hang out on that. And once it stops switching, that's a really good thing actually. So again, try to find some of those sore spots. And again, if it's too painful or too sore, I would recommend maybe trying a foam roller. Unfortunately, the foam roller may not be the best for that area just because of the bony anatomy that's around there. The foam roller just may not fit depending on the size of the foam roller that you have. Now, the last one we have is the TFL, or the tensor fasciae latae. That's going to sit kind of right here. If you find that big bump in the front of your hip, it's going to go right to the side of that, okay? Don't mind my string. That's on the tennis ball here. So you can put that right there, and then you're going to lay on your side, and you're going to try to get that to kind of release a little bit there. The other thing that you can do to help improve a little bit, kind of a technique called pin and stretch. So what you can do, my knee is bent, and once you're on that sore spot, you can kind of lift your back foot up off of the ground, and my knee is bent. You can see that'll help kind of what we call, again, like pin and stretch. So you'll find that sore spot, and you can kind of stretch the tissue from that area by lifting up a little bit, and that may be helpful to help relieve some of that tightness there. In my experience, the TFL is the one that is usually the most tight and really limits hip internal rotation mobility. And if you can get that to kind of relax and release a little bit, you will definitely have some improved hip internal rotation mobility. So give these a try. I would do that for, say, about a week, and hopefully that will help with some low back pain and even some hip internal rotation. If unfortunately you're not getting any improvement following these things, I would definitely make sure that you reach out to a physical therapist or a chiropractor or your trusted healthcare provider that can hopefully help you improve that and get over some pain. If you have any questions or anything along those lines, or if you'd like to reach out to me, maybe you have a specific situation or something that's not going to be fixable with something like this, please don't hesitate to reach out to me. I will put my email down below and be able to help you out. We can schedule a call and see what we can do to help you in your situation so you can play your best. And not even if you're not playing golf, or our number one thing is to just get you out of pain and enjoy an active life, basically. So give these a try. Let me know how they go. And looking forward to hearing some great stories on improvement here.